top line stats of where we are, where we're headed. I'll talk a little bit about what guidance is staying the same, what guidance is changing, and then be more than happy to answer any questions. The bottom line up front here is that we're in another surge. This is what is our now 4th surge. And I mean, the real difference this time around is that it's largely preventable. And that's the real kick in the gut on this. That's what we're going to see over the next couple of months across the country is states, or even within states, communities that just have not gotten a lot of folks vaccinated are going to experience surges. And that's where we are right now. So just some top line stats: we've more than doubled the number of hospitalized COVID patients throughout the state in the past 2 weeks. We're up to 560 or so. We were at around 250 about 15 days ago. We have some room to go before we get knocking on hospital capacity, but what's a little bit different this time from the last surge we had, was late December, early January, is hospitals are already pretty busy with other stuff. There's a lot of RSV going around causing pediatric infections and some adult infections. Hospitals are very busy with that. And there's a nursing shortage across the country that we face very acutely in Louisiana. And it's not hard to see why. Nurses had a really hard year. They're still having a very hard year, very traumatic. And a lot of nurses have left to pursue non-clinical work. Some have taken time to travel or take other gigs. Some have gone back to school. But it's been very challenging the past couple months for hospitals to retain and recruit new nurses. So most hospitals will tell you that at the moment, it's not the physical beds that they're worried about, it's the staffing resources to be able to care for patients. Certainly the hospitals that I'm that's been the experience. So that's our concern. Percent positivity for new cases has gone up. It's from 4, it's now 6.3% across the state. We've been sustaining increases in incidence, the number of new cases diagnosed every day for the past 24 days. And when you look at each region specifically, which is what we did at the press conference, the trends are exactly the same in all 9 regions of the state. All 9 regions have increasing cases, increasing percent positivity, increasing what we call COVID-like illness, or the percent of ER visits that are attributable to COVID-like symptoms, and increases in hospitalizations. So we are in a surge. Mississippi is in a similar boat. Arkansas is in a similar boat right now. And the real common thread there is that vaccinations here and in those states as well are just not close to where they need to be. There's no question that this is being caused largely due to the Delta variant. The Delta variant now accounts for 58% of all new cases of COVID nationally, and 59% of new cases of COVID in Louisiana and neighboring states. So, if one was to be exposed to COVID tomorrow, odds are more than likely, greater than 50%, it would be Delta. We know Delta is more transmissible. It's likely more virulent, meaning it likely makes people sicker. It certainly gives higher viral loads in people that have it. And it seems to be causing more illness in kids or younger adults than we have seen with previous variants. And there's been some really troubling anecdotes over the past couple of weeks of younger individuals, largely unvaccinated, getting very, very sick or dying with COVID, and just complete tragedies. So we're in a surge. That's the bottom line. I don't know how long it's going to last. I don't know how high we're going to get. Largely avoidable. But the first message to put out to people is that the risk in Louisiana, everywhere in Louisiana, for anyone, vaccinated or not, the risk is higher now than it was a few weeks ago. It will continue to be higher over the next couple weeks. I'll come back to that in a second. Let me touch on vaccination numbers again. We're just not anywhere close to where the state needs to be able to provide, number one, the protection for families, that there's not unnecessary morbidity and mortality, but also enough protection to really reduce transmission, to create herd immunity. We're not anywhere close to that. 40% of the state's general population has initiated the vaccine series, 36% has completed. You compare those to national stats where it's 56% and 48% respectively. Of adults 18 and over, 50% have initiated the vaccine series. So there's 1.84 million Louisianans who have at least initiated the vaccine series. Nationally, there's been 336 million doses administered. So anyone who wants to say there's not enough data out there, or they want to wait and see, 336 million doses administered has got to speak for something. In terms of racial demographics, this is actually one of the brighter spots of Louisiana's vaccination campaign. While we need to increase vaccinations across the board, across every demographic group, we are doing better on equity measures than almost every other state is. We're just lower across the board, but in terms of the equity measures, we're actually doing better, and we've been recognized by the White House a couple times for that. So of all vaccinations administered, now 29.5% have been in Black Louisianans, 57.8% have been white Louisianans. Those numbers have inched up a little bit each week that we've measured it. We've made continued but small progress each and every week that's been measured. That's much farther along than the national benchmarks are, even though we still have much more work to do here. The data that we have to look at is also of a much higher quality than national. So the CDC only has racial demographic data on 58% of all vaccine administrations across the country. We have racial demographic data on about 93% of all vaccinations. So we have high quality data here. We're doing better on these equity benchmarks than almost every other state is. That's largely due to really intentional efforts by the vaccine campaign, by individuals on this call, and by the equity group as a whole. So it's good to know that those efforts are paying off, even though we have much more work to do. And the same goes for Hispanic Louisianans. 5.1% of all vaccinations have gone to Hispanic Louisianans, who represent 5.3% of the population. And that's also, again, ahead of national benchmarks, but it also needs to get a little bit better. Let me talk for a second about breakthrough cases. So, the thing for us to remember is these vaccines provide excellent, but not absolute protection. And you have a vaccine that's 94, 95% efficacious. That's tremendous in the world of vaccines. It's very rare to get a vaccine that good. Most vaccines are not that good, but it's also not 100%. And so we are seeing breakthrough cases. I'll tell you, if you go back to the beginning of February, 97% of all COVID cases, as well as COVID deaths, have been in individuals who are not fully vaccinated. We do a good job tracking breakthrough cases. Of all the cases of COVID since the vaccine campaign started, just over 2,000 have been breakthrough, or people who are not yet fully vaccinated. That represents 0.1% of all fully vaccinated Louisianans. Of those 2,000 or so cases, 125 have been hospitalized, or 0.008% of everyone fully vaccinated. And of those, 34 have died. This is from COVID, or 0.002% of everyone fully vaccinated. The median age of people that get serious breakthrough cases, meaning hospitalized or death from COVID despite being fully vaccinated, the median age of those individuals is 72, which makes sense of what we know of COVID. The consequences are higher if you're older, and the immune response one gets to a vaccine is a little bit less as you get older. We're going to see more breakthrough cases as the amount of COVID increases. One's chance of having a breakthrough case goes up as your chance of being exposed to COVID on a day-to-day basis goes up. So we're going to see more breakthrough cases, by and large, for the overwhelming majority, and that's an understatement, of people that have a breakthrough case. they're going to have a mild or asymptomatic case. The serious breakthrough cases are really few and far between, and when they do happen, mostly in people that have serious underlying conditions. But we are going to see some more breakthrough cases. I'm saying this by way of, I think, messaging, particularly the vulnerable communities, needs to shift a little bit now that we're in a surge. Prior to us being in a surge, and as of a few weeks ago, we were pretty safe in telling people, listen, if you were fully vaccinated, you can not mask and not distance and be pretty assured of your safety. That's not the messaging I think is appropriate right now. So I wanted to run through what I think the best public health messaging is. For people who are not fully vaccinated, we'll start there. The messaging has been and continues to be, and this is a clear consensus public health recommendation, CDC, LDH, WHO, that you should be masking and distancing, particularly when you're indoors and around other people. For people that are not yet fully vaccinated, there's more nuance now to the recommendation. And that nuance is families should take stock of what their risk is, what their risk tolerance is as well. And families that have individuals of advanced age, yet fully vaccinated, families that have people with underlying health conditions, yet fully vaccinated, families that just have a lower risk tolerance and want extra protection, despite being fully vaccinated, now that we're in a surge, should also strongly consider masking and distancing, particularly when indoors and around other people. That's not going to be the case forever, but now that we're in a surge, I think we need to flip this mindset, because again, these breakthrough cases are going to go up just as the amount of COVID out there goes up. That's just kind of the mathematics of it. And I don't want people to feel like because they're fully vaccinated, they have zero risk. They have a low risk, but it's not zero. So that demands a change in some of the messaging that's been put out. At the end of the day, we just need more vaccinations. We've not bottomed out. We're averaging about 2,000 to 4,000 individuals getting vaccinated or starting the series every day. So that's not for nothing. And there still is opportunity out there. I mean, when we talk to folks, there still are people that haven't dug in their heels and likely will get vaccinated at some point, just haven't yet. And they can be moved to do so if they get their concerns addressed. So that continues to be where our efforts are. I think it's easy to get pessimistic here, but when we look at the data, I mean, we're still making progress. It's just slower than we want and need it to be. Dr. Brown, I'm going to pause there, but be more than happy to answer questions if there are any.
There are a couple of questions in the chat box. One from Dr. Davis. Do we have a breakdown by rural, urban for vaccination rates?
We do. I mean, there's information. I don't have it by rural, urban particularly, but you can go in and look by parish. And that's on the LDH coronavirus dashboard. You can dive in by parish and see vaccinated, completed, and initiated by parish. I'll tell you the more metropolitan areas are doing the best of anywhere in the state right now in terms of vaccinations. Orleans Parish, Jefferson Parish, East Baton Rouge is just behind that. We're having the most trouble in the real rural parishes.
And then Pastor Jackson has asked, can you share the percentage of numbers again for Black and white Louisianians?
Yeah, sure. And I can, I'm happy to text this into the chat so you have it written down once I'm done talking. But of all vaccine doses being administered on a given day or average, 29.5% are being administered to Black Louisianans, 57.8% being administered to white Louisianans, and then 5.1% are being administered to Louisianans who identify as Hispanic. And I'll type that in the chat once I'm done talking.
Great. Okay, we'll open it up for any questions for Dr. Cantor.
Yes, this is Dr. Wilkes. Joe, have you been able to measure how effective that lottery campaign has been? And do you have it broken down by demographics? Did one group seem to respond more than another?
Thanks, Dr. Wilkes. Don't have demographics on that yet. For overall numbers, it is a little bit too early to say. I mean, I think everything now would be a little bit preliminary. The first two winners actually just got announced today. But what we saw about a 14% bump in vaccine administrations in the week after announcing the campaign, and then leveling off of vaccines. And since that time, the number of new vaccine administrations has been pretty flat. When you look at the overall trajectory, we spiked in administrations a few months ago, and then the trajectory was going down very sharply until the vaccine campaign was announced and leveled off. So I think one interpretation of that is that we were plummeting, and this kind of kept it at a steady level. We want it to be higher than it is, but it's held steady. I think a couple more weeks into this, we'll be able to do some more sophisticated analysis and try and see if it was worthwhile from what perspective. There were other benefits. We got a lot of earned media out of it. And I really do think that we got more vaccinations out of it than we would have otherwise. I think it'll take a little bit of time to better quantify that.
Okay, I think Christian Engel from the YMCA.
Yeah, thank you, Dr. Cantor. I'm just curious if any of the guidelines are going to be changing for child care centers, daycares, our K through 12 schools, universities based off of this. I know everything right now is kind of optional, but listening to this, I'm just wondering if you foresee any stricter guidelines coming into place.
Hey, thanks, Christian. Nice to see you. At the moment, there's not any new orders that are being in place other than localities, have the ability to make the rules for themselves. The guidance, from both the CDC and LDH, and we put out documents to this effect, is pretty clear. It's just non-binding, at least from the state level. And the guidance says, pretty much, I'll paraphrase shortly, no matter what the setting is, whether it's educational, higher educational, daycare, people who are not fully vaccinated should mask and distance. We interpret that further to say should absolutely do it down to 5 years of age, between 2 and 4 years of age as tolerated. Students, teachers, faculty that are fully vaccinated, probably don't need to in those settings unless there's higher risk. But again, those are best practice guidance from LDH and CDC, not binding right now unless the locality makes it so.
Any other questions for Dr. Cantor? Dr. Ferdinand?
Yeah, not to distract from the vaccination message, which is very important. Considering that we're going to have an increase in infections, potentially an increase in hospitalizations, the percentage of deaths will go down because a lot of them are going to be younger persons. Should not we at least consider messaging around the use of monoclonal antibody infusions, do a quick and dirty survey of the parishes, what's available, and inform people, because it may actually decrease hospitalizations, which is probably going to be the biggest impact of the Delta variant. I'm here at Tulane Hospital, just came out of clinic. I had 2 medical students and nobody else because the nurse quit. And we know there's a nursing shortage. It was made acute by the pandemic. Coming back out of the pandemic, people are coming into the hospital for elective and semi-elective procedures. A lot of clinics are opening up and the nurses are just tired. So we need to keep people out of the hospitals, and monoclonal antibody has been shown to decrease hospitalization by 80%. That message has not gotten out to the public. I think most people and even practitioners don't even know about it. You don't have to go into a detailed answer at this point, but my question is, don't you think that's a potential communication message?
Yeah, Dr. Ferdinand, I agree 100% with you, and thanks for making those comments. We monoclonal antibodies it's an IV infusion given over about an hour that is geared towards people who have very recent, with their first few days diagnosis of COVID, not sick enough to be in the hospital, intended to keep them not sick enough to be in the hospital. There's a lot of supply. We were supply limited at one point. We're not anymore. There used to be 2 products available, one from Eli Lilly called bamlanivimab and one from a company called Regeneron. The Eli Lilly product, the bamlanivimab, is now on hold because the Brazilian variant, the P1, has some resistance to it, and that's prevalent enough to cause a difference. But the Regeneron product remains effective and is widely available, and it actually is pretty widely available throughout the state. Just to Dr. Ferdinand's point, we probably need to do much more work to communicate that. So I'll take that back to the team, but thanks for raising that. Totally.
Let me just chime in, Keith. I actually did a video with another group, and we've been pushing that real hard. I liken it to the Clinton administration. Don't ask, don't tell. If you don't ask, you're not told about the monoclonal antibodies. So one of the suggestions is that if you're being tested for COVID, then those patients need to be informed about the monoclonal antibodies at the time of testing, particularly if they meet the criteria. So there are some groups that I know that I've been working with that are pushing it hard. And I think that's a great suggestion to get that baseline, because you're absolutely correct. I know we've been pushing it hard in our community and treating a lot of people, but that will blunt the hospitalization and the death rate if we can get that tool out there to be used the way it should be.
Can I make one quick follow-up? I'm actually not a proponent of using public funds for lotteries and gambling. Malcolm X went to jail as a hustler and a numbers runner. Now we call it a lottery, and we endorse it in various states and cities. If you look at the amount of money that's spent, and I know the decision is made, nobody asked my opinion, but I'm gonna give it anyway. If you look at the amount of money that's been spent, if we had paid some trusted messengers in the clinics and the doctor's office, given a small reimbursement to doctors for COVID education, which they could have translated to spending a little bit more time with their patients and their families and significant others, I would think you would have a long-term impact and a down the road impact than the gold rush. Most people don't feel they're going to win the lottery anyway. I don't play the lottery on a regular basis. I don't do the balls. So once you have that 1 or 2 or 3 or 4 people who win the lottery, that impact dissipates quite quickly. If you had empowered trusted messengers and the staff in the doctor's office and the primary care providers, federally qualified health centers, a small stipend for COVID education, it would have long-term enduring effect. There's no comment you need to make on that, but I just want to put that on the record.
Any other questions or comments?
I'd just like to say it'd be hard for me to agree more with anybody than with Dr. Ferdinand just now. I think that was a wise statement.
Okay, if there are no other further questions for Dr. Cantor, we thank you so much for the update, Dr. Cantor. We are here, we meet with Dr. Phillips on a regular basis, and we're poised and ready to do whatever it is that we can do to get as many people as we can vaccinated. So we are here to help in any way that we can. And so you are welcome to stay on, Dr. Cantor. We will transition to Mark Thomas. I see he has joined us from LDH. Dr. Courtney Phillips has a conflict, so I understand that you'll be filling in for her, and we welcome you.
Yes, ma'am. Thank you, Dr. Brown, and good afternoon, everyone. Dr. Brown, I was advised that I should provide an update on the Bring Back Louisiana campaign. I wanted to make sure that those were the expectations. And so, folks, thanks again for having me, and apologies on behalf of the secretary that she could not participate today. So what we're seeing with the Bring Back Louisiana campaign is that it is evolving. If you folks recall, when we first started the program, we started off with the identification of census tract areas where there was high social vulnerability, low vaccination, typically communities of color and those rural areas. And when we initially started, we really focused on those areas and events in those areas. Quickly, we found that we needed to be not only focusing on those events, but pointing individuals who were interested in vaccinations to other events that were already taking place within those communities. In addition to that, we recognized that we needed to have additional resources, what we call point of contact vaccination available to those persons. One reason we came to that conclusion, many of you folks are aware of Nurse Carla and her situation and how effective she was. And so we've sort of evolved from the canvassing to now we're bringing in mobile vaccination units, we're bringing in nurses and so forth. Now, to date, we have, the numbers related to the campaign. And the first part I'll tell you about is what we call our ground, what we call our ground game campaign. And so to date, we've sent out almost 3,000 canvassers around the state to door knock and to invite folks or share information about the vaccinations. And with that, these are community-based organizations. Some of you know some of them, like Together, Power Coalition, Louisiana. So some of these are very much local organizations that we've been using in that process. And so real proud to report that we've door knocked 130 doors, 130,000, I'm sorry, in the state. That's over 12,000 in every region, 13,000 in every region of the state. We have phone banked almost 900,000 calls, and that's 80 to 90,000 phone banks. And these are into those communities that are most at risk there. And so very robust ground game, and we're growing it. And the way we're growing it is moving to the nurses, to the folks who can vaccinate on the site. So for example, as I mentioned, the Nurse Carla group there, we've hired 13 new nurses, and we're going to be partnering them with the community-based organizations, and they're going to be going out with them. As we get to the summer months, we recognize that the canvassing is going to slow down, and folks typically are going to get burnt out from that. So we're going to have to be a little bit more strategic in how we reach out to those individuals and those communities. Now, in addition to that, that's our ground game. That's what we're putting a lot of resources in. But we've also continued to do some of the other work outside of that, recognizing that the campaign is much bigger than just the door-to-door. And so we've been working to put collaborations together with different entities out there. First, we started with some of our business entities. So we work with Louisiana Economic Development to reach out to over 1,100 businesses and to offer them vaccination. These 1,100 are the largest businesses in the state, to offer them vaccination opportunities for their employees. In addition to that, working with the Black Chamber of Commerce to do the same thing at some of our smaller businesses and minority-owned businesses, just to increase the outreach there. We've been working with HUD, Housing Urban Development, around the state to put on vaccination events. The goal is to do outreach at every one of the HUD development sites across the state. So we've been working in the north, now working in Alexandria. So just trying to put that together. Also recognizing that, with the change in age. So when we started campaign, we were 18 and older. So now with the change going down to the 12-year-olds being eligible for the Pfizer. So what we're doing right now is working summer programs with the Department of Education. So they have summer feeding programs, over 1,100 summer feeding programs across the state. We're reaching out to those families, trying to set up vaccination events, as well as all of the camps that are associated with our public school system. So great push that we're making. We've also started looking at our MCOs, our managed care organizations, those, and as not only those that are affiliated with LDH, our managed care organizations, but also those that are private commercial insurers as well, to try and assist them with identifying their members who have not been vaccinated to date. They were just, broad information, general information to all of their members, but working to look at some data sharing agreements whereby they can target those individuals that are a part of their plans to reach those individuals. The work that we've been doing with our media, we continue to work with the Bernie Group. We have an overall campaign, media campaign. You should be seeing on the airwaves tons of media about Bring Back Louisiana, getting the vaccinations, whether it's on television, radio, social media. So when we say social media, we're making a pointed effort to appear on Facebook, Instagram, Twitter, TikTok, to reach some of the younger folks, generations, and we have data around that. And so all the information that I am sharing with you, I could send it back to you in the form of a report that gives you an idea of, the effectiveness of some of the activities that we are putting in place. Most recently, the White House has started to give some guidance on some of the things that they think that cities, states, and especially areas that are potential hotspots like we are here in Louisiana. Fortunately, some of the things we're already doing. So they're talking about canvassing door to door, also the faith community. Now with the faith community, we're working still with Reverend Tolbert and that group. As a matter of fact, Reverend Tolbert, who is our National Baptist Convention president, he just put out a video on yesterday, really compelling members of the clergy and the church members to go out and to get vaccinated. We recognize that even though early in the campaign, we did a lot of work with the churches. So we had events, almost thought we were saturated because we had so many events. The numbers started off high and then they became low. So we assumed that in the churches, we were making a great headway, but just looking at the numbers of people not vaccinated, there's still a lot of work to be done with the churches. We're bringing on some additional denominations, the AME, African Methodist, Episcopal, the Church of God in Christ. We're working on partnerships to get inroads within those churches and that clergy, as well as most recently, we've brought on the Catholic Bishops Association. So working with Archbishop Amon in New Orleans to do the same type of promotional that we're getting from Dr. Tolbert, looking for the same thing there, but also webinars. We also see this as an inroad to reach some of the other marginalized groups of individuals and populations. So to the Hispanic apostolate, to the Vietnamese group, we've done some great work with working with our Native American population across the state. So actually, that's a group that's doing pretty good. And I'll finish up with this here. So not only that, we have the citywide challenge that's going forward right now between Baton Rouge and New Orleans. Great conversation with the mayor of Shreveport on yesterday, talking about doing something very similar. So we have to find a sister city. And so looking for other cities to step forward. Our folks have reached out to the folks in Opelousas, the folks in Ville Platte, so forth, reaching around the state, trying to see if there's an interest. And of course, if you folks can help us identify mayors and leaders of cities who could join that challenge, I think at the end of the day, it's going to be local and it's going to be within those communities. Speaking of that, we're also working with the Parks and Recreation. So this week, you'll see that with the BREC in the Baton Rouge area. So there's a Liberty Lagoon park here. And so we're going to be doing vaccinations there where they're going to be giving free admissions to their water park, as well as to the zoo and to the golf courses. And we're trying to, it's just a template and we're learning, but we're working to do the same thing in New Orleans, the same thing in Lafayette, and the same conversation we had with the mayor in Shreveport on yesterday. And so we're recognizing that we have to continue. Now is not the time to draw back. Now is the time to continue to dig deep, to continue to listen, to get new ideas and to bring on new partners, some with new ideas and renewed energy. And then our goal is to continue to move the needle. It's a slow march. We recognize by looking at the demographics that we have here, what's happening in the southern states. There's a set of cards that were dealt to us, but we're not shying away from that. We want to continue to move. We want to continue to move in the new dosage. We want to continue to grow in the number of people who've completed their dosages. And every time we do that, we're saving lives here in Louisiana. So Dr. Brown, I'm going to stop there. It's quite a bit. And I can get a report to you with that information in it as well, and take questions.
Okay, thank you, Mark. We have a question from Dr. Davis regarding the door-to-door campaign. Did you have any pushback? Do you have any data on whether they opened the door or not, or the percentage of who you're able to reach to get vaccinated from that door-to-door campaign? Dr. Davis, is that the essence of your question? So are you experiencing that, Mark? Any
so I can go ahead and so the answer is yes. So we look at a response rate. We try our best to make sure we're sending the right people, the right voices, and the right communicators to the right community. So that's very important. And then we do capture the data. So when they go to a door, if there's a yes, and there's a vaccination, yes, we capture that, as well as those where folks are not interested. So we'll know not to come back to those individuals. And then we try to look at the success rate of all of our CBOs. So they are all trained, going through a thorough training orientation. And then we want to see the effectiveness, some more effective than others. We want to know why before we keep investing. Also, we want to know if we need additional community-based organizations. So Dr. Davis, we do capture that information, and we can try and get that to you as well.
Yeah, I was just wondering, because I had no idea if it would work. I was working with this some, and at first the Department of Health wanted to survey people when they went door to door, as well as give them information about access and ease of getting vaccinated. And I just wondered about the efficacy of the whole program based on what Dr. Ferdinand said. It probably is an expensive program. I just wonder if it was working, and does it work in rural areas or low income areas? I was just very curious.
Good questions. And so, that goal is still intact, that we want to educate, create awareness, and assure that there's easy access to the service, so much so that, as I mentioned earlier, we're looking to bring vaccinators on the spot point of contact. Now, with that being said, as Dr. Cantor referred to earlier, we're just getting our first formalized data. We have an agreement with Blue Cross Blue Shield of Louisiana to help us to look at the areas where we have canvassed, the areas where we have focused, and to look to see if around events and in that census tract, if we're seeing any progress, if we're seeing a difference. And so in general, we got our first draft, dirty draft of data on yesterday. And it shows that the areas that we have focused on, yes, we can see a bump in the number of folks who are getting vaccinated. There are, however, what we also found is that the areas where we were there sustained. So sometimes they door knock for one day and they leave, but then there are other areas where they may focus on an area for 2 weeks. We found that in the first shot of the data that's most effective. We've seen some numbers increase a little better there. And there was some that it just didn't have an impact at all. So if I could, just on the preliminary data, the majority of the events led to increased or sustained vaccinations. And so what we're doing now is we're comparing it with control groups, other areas with similar demographics, similar social vulnerability, where we did not have interventions to see if compared to those, we made a difference. Preliminarily, the answer is yes. But we're about at least 2 weeks from some hard data that the folks from BC Blue Cross Blue Shield are willing to hang their hats on. So yes, overall it's working, but it's evolving. As Dr. Cantor said, some of those folks who were just in the middle and so forth, the folks that we're working with now are folks who, quite frankly, have dug in their heels. And it's going to take those influencers that the doctors mentioned today, those trusted voices. We're finding that ministers, doctors, those are some of the trusted voices that folks are still listening to. And so we need to engage those folks more so now than we've done in the past.
So will you give this to Sandra so we can get the numbers after you compare it to the control group or Blue Cross does?
Yeah, all that data, everything we have is going to be public. Yes, we'll come back and circulate it to the group here. And I'll make a note here, Dr. Davis.
I had a,
Dr. Wilkes.
yeah. Well, thank you for all your hard work, Mark. I know you all are working hard.
Yes, sir, Doc.
It's a huge challenge. A couple of points I wanted to make. First of all, Tracy, I did send that clip of that video on the monoclonal antibodies, if you want to send it out to folks, and Dr. Cantor. The present, I think you're right to go back to the clinicians and the faith-based organizations and those things, but I think what could also be extremely effective if you start getting more personal testimonials. I think people are getting saturated with celebrities and people that they know, but I think if you can get the messaging of people that have experienced COVID, that have had lost ones. I mean, we need to start showing. I know one state they showed a person was an actor that was being intubated and put on the vent. Sort of like that old commercial, that woman that had lung cancer and she came on TV. She took off her wig. She took off her dentures. Those are powerful, aversive messaging that, I'm like Dr. Ferdinand. I don't believe in really the lottery and the gimmick. I think that can, help to a degree, but I think the more personalized you can get the messaging, the better off. And to the point earlier, when you're knocking on doors, telling them about getting the vaccine, that is another opportune time to let people know about monoclonal antibodies. If you don't take the vaccine, if you get it, you better ask, can you get the monoclonal antibodies if you get infected? But they need to have that information also. The other part, to the readiness part, to Dr. Davis's point, if you're knocking on a door, and I don't know if you've given consideration and how cost effective it would be, because I know we have some vaccines sitting in and they're going to expire, so we're making this hard effort. If you went out to these areas where you're door knocking and you went out in a mobile unit or a small van that had the vaccine readily available, and if they agree to say, yeah, I want to get it, and you have it to get them right then and there at that moment when they've been convinced, if they are convinced, that way you'd have a better chance, if you see what I mean. If you're knocking on a door, if you say, I'm gonna go canvass the whole neighborhood, and you had the vaccine on board ready to give it, then you might have a better chance of getting them at that moment, rather than going through one more step. Okay, now you need to schedule to come get the vaccine. Is this something as a strategy you might want to think about?
Yes,
I know,
sir.
Terry, you had experience with doing mobile mammography and some of the things. When you bring it to the people, you may have a better chance of getting a higher yield.
Yes, sir. And that's where we said that, we're evolving to bring the nurses there, to bring the vaccinators there, point of contact, the mobile units. And so we started off with that model that you just described. And so now when we're bringing on any additional resources, it's about point of contact. So folks don't have to delay, just as you said, Dr. Wilkes. Great advice, sir.
And look, one more thing. The local mayor of Patterson, Louisiana, Rodney Grogan, back to elected officials, he made his own personal service video with his whole staff. And their theme was, I got my vaccine, what about you? And it was very effective, and it's been playing in our parish, and the other mayors are about to do it. To your point of having local elected officials that people trust, I think that's an easy message. It's probably on Facebook. If you look him up, it was very well done. And
so, Dr. Wilkes, I think we're going to start seeing that type of communication, just as you said. Yesterday we were meeting with the governor, and the governor said that, it's time to start bringing those people who have lost loved ones, those people who have gone through a tough trial in their lives, to bring those folks and bring them front and center. So I think you're going to see that. But another media platform I didn't tell you about is called Soapbox. And Soapbox is another one that we're promoting, where it allows lay people to go to a site and they just get on your soapbox, the issue that you want to do. We have unlimited access for, all of our influencers. You don't have to be an influencer. You can do it for your family. You can do it for your church and so forth. And that's catching on pretty good as well. So that's an opportunity, like you said, to get into, get past some of the celebrities and the fanfare and start hearing from real people. I think folks need to hear from that, from those folks as well.
I like that. I like that.
Yes, sir.
Thank you, Dr. Wilkes. Mark, I'm not sure if you're aware, but Southern University School of Nursing will be getting a mobile health unit. We call it the JAG-mobile. It's going to have 2 fully equipped medical exam rooms, fully equipped with telehealth medicine. We have a slogan that says the mighty JAGs of SU, bringing healthcare to you. And so we can talk offline more of how.
Yes, please. Yes, please. Would love that. Now, we did something similar at our church, and I thought we were being original. We call it the Gospel Mobile, and with the Jag Mobile sounds better.
Yes, yes. So that's certainly
Dr.
something
Brown,
partner with.
can you say about the Southern Nursing School in Shreveport getting one like that too?
I certainly will push for that. I certainly will. But we had one in the early 90s, and we were able to acquire another one through the CARES Act. So that's something we certainly can look to expand. And we also
More than certain we can use it.
Yeah.
I'm certain we can use it.
Thank you. Those were all very wonderful suggestions. Mark, we're going to be meeting with Dr. Phillips just to recap what you can bring back to her, and what we're going to be meeting further, or Dr. Ferdinand's request about allocating some funding to primary care offices or physician offices to launch an educational campaign so that the message can be of enduring capacity long-term, as opposed to just, the lottery. We also would want to address the shortage of human supply, nurses, physical therapists, respiratory therapists, as we prepare and embrace for this surge. There is where we have PPEs, we have the medical, supplies. It's the human supply that is going to be gravely impacted if this surge is what we expect it to be. The monoclonal antibodies for those who meet the criteria. A way to get that information, to the people as we're doing this, vaccination campaign, and personalizing the messaging with personal testimonies. Those who have had COVID and have lived to be able to tell their story, or those who've lost someone to COVID, that would be, impactful. And lastly, the mobile unit, and certainly looking at how we can partner with use of the JAG-mobile as one aspect.
Yes, ma'am.
Anything else that anyone would like to add for discussion or inclusion as we're, giving LDH this feedback? All right, thank you, Mark. I'll be putting all this in writing and, with our communications.
Yes, ma'am. You folks take care now.
All right, thank you. Last on the agenda is an update from our Communications and Messaging Subcommittee. They have continued to meet every week, crafting messages from trusted sources and making sure that our communications reach the audience that we want it to reach. We have Ms. Janine Tate. She serves as the Communications Director of Southern University System, who works very closely with the Communication and Messaging Subcommittee. So Janine, I'll turn it over to you.
Good afternoon, everyone. And just have a few short updates. As we all know, messaging has been changing pretty rapidly over the last 2 months. And pretty much you all know who we all are by now, continuing to get messaging out to minority populations. And I'm hearing from these talks today that younger people are part of that now more than ever, especially on our college campuses. So again, this is what we've done in the past, what we hope to continue in the future, the earned media, paid media in different locations. Again, this is kind of regurgitating that. So our main messaging now, what I've seen on social media, as we've all seen on social media, there's a lot of misinformation out there, a lot of miseducation out there. I think we just really need to ramp up going beyond the headlines and pushing to say, okay, this is the age group, this is the race, and all of that, all of the things that Dr. Cantor shared with us earlier. Provide real-time info about the vaccine locations and COVID testing. We've always done that. We'll continue to do that via our website and social media channels and sponsored social media, which we had a great return on. So hopefully when we start that back up again, we'll be able to provide that even more. Again, educate about the latest variants and effects. As you see, I took that screenshot right before this meeting. Of course, the headline has changed some more since the governor's address. Again, mask if you are not vaccinated or at high risk, including those who are vaccinated but have compromised immune systems. I am a witness to that. Continue to respect social distancing. I heard Dr. Cantor say about being masked and distant, so we're on the right track with that. And continue to do regular good hygiene with hand washing, sanitizer, etc. Want to just push across the risk of not being vaccinated, especially with the audiences that we deal with, more hospitalization or risk of death from health issues with high blood pressure, diabetes, autoimmune diseases, and all of that. You can spread it to others that may have a weakened immune system that's in your home. And we also have long COVID, which I'm a witness to that as well. Long COVID with the brain fog, shortness of breath. You've had a lot of long-term effects from this. So I think a lot of people don't understand that, oh, I got over COVID in 2 weeks, my 10 days are up. We have to really push across that there is a thing called long COVID and why it matters. Okay, so now Dr. Abear worked with, I'm sorry, Dr. Brown, the other group that we worked with.
LaCille.
Yes, they produced several videos talking to audiences. As you can see, this is a neighborhood person that someone could relate to in New Orleans. At the end, she'll say what I believe is a good tagline with us moving forward. So I will play, pandemic. Excuse me, I'll play that now.
The COVID pandemic is far from over. The Delta variant is here to stay. So if we want to enjoy football games, Thanksgiving, time with family and friends, go to restaurants and bars, we must get vaccinated. And we must get vaccinated today. So if you don't do it for yourself, do it for the culture. Get vaccinated.
Was everyone able to hear and see that well?
Yes.
Okay. So that's one of it. And as you heard her, she said, do it for the culture. So we expand upon that, not just to say a particular race or a particular ethnicity. So we know in Louisiana, we have the culture of something like this. You have the bands going through for parade season. You have people enjoying the face-to-face and things. We can't get back to all of that good stuff safely unless everybody's vaccinated or at least wearing the mask when you're supposed to and things. Also, I also pulled some more representation of our groups. Again, these are stock photos or photos that I have pulled from news organizations around the state. But you get the idea, the culture of having a crawfish bowl, the culture of tailgating, all of these things that are coming up. We want to make sure that people are doing it, so not just for yourself, but for the culture of Louisiana. So the immediate strategy is to continue the development and posting of videos such as this with various people, as we said, people that are trusted and in their neighborhoods and communities. Continue to develop and post educational materials and graphics, continue to share content from LDH, our universities and other partners, develop and execute approved paid media budget as it is applicable. And one of the biggest things is to aggressively pitch and secure earned media featuring the experts on the subject matter. And as a communications professional, this has been the best expert list I've ever dealt with in life. I don't have to go reaching too far to get someone to talk to media, or you're already talking to media on your own with your own organization. So we're able to push those things out and to count those. So thank you very much for that. And the great Dr. Keith Ferdinand, who I am honored to be on this task force subcommittee with, I left this slide up, Dr. Ferdinand, because that quote still rings true. And it was so effective when you said it, and you're right on time with it. Again, it's evergreen. So again, we're just pushing these vaccines and other ways that we can take care of ourselves and each other. Again, we will be continuing to ramp up our social media efforts the best we can. And again, we're sharing information from our local, regional, state, and federal partners in the fight against COVID. And again, the website is sus.edu/LA COVID Health Equity. That's at the bottom of your screen. And those are all our social media channels that we currently have and will continue to populate. So that's where we are at this moment. That's it.
Thank you, Janine.
Yeah.
You can stop sharing.
Yes, ma'am.
Okay. So any questions or suggestions for Janine? They have a very powerful think tank, but of course they are welcoming any suggestions that you may have that can help get the message that is relatable in getting our messaging across. There are several other videos that they're working on, and this, was one of them that she shared today.
I don't know, this is off the wall, but it's sort of, playing on the theme of Delta, and I know that's the Delta sorority. Delta's against Delta. That might be something that I know you have a large group in Louisiana in particular. That might be something that might make some, a niche that could possibly be used in a positive sort of way.
That's a good idea. That is my beloved sorority. So we may have to expound on something.
I know y'all do a lot of work, and you're trying to give Delta a bad name with this virus. So I don't know.
Yeah. You got that, Janine? That's a good
I jotted it down.
That's good. That's good. And any other ideas that are catchy? I mean, there's a lot of videos out there that are getting a lot of, that are going viral, I should say, from different groups and organizations.
Janine, this is Terry. I have a question. It's my soapbox is rural areas, because I'm concerned about what's going on in rural areas. Yes, I thought your messaging was very effective and catchy for minority populations. What have you found effective with rural populations? And how do you reach them?
That's something that we're still looking at. I'm from a rural area. When I went home to visit, I'm from Washington Parish originally. I went home to visit between there and St. Tammany Parish. I didn't see a mask in sight, and I know the numbers and everything. So that's something that I'm looking at on the marketing messaging side. Who do those people trust? Because you have I like rural communities are more political than our cities. So it's like finding those people that are trusted in those communities by all and if that's even a way to go. But that's something I'm looking at definitely, because I know that's a population within itself and it's not monolithic. So definitely thank you for bringing that up, but we'll definitely be looking into that.
I think you can also use what's being done on a national level. The Biden administration has a national campaign against mis and disinformation.
Mhm.
That's what I know we're finding in most of the rural communities. I don't know if you've seen that, Terry, but social media with all this misinformation is really, really hard to combat. Try to fight fire with fire and get, on those platforms that people to get into that space to counteract some of this misinformation. It's just, it's a really challenge. It's a tough challenge because they're not getting their source from what I think are credible sources. And I don't know how I'm not savvy enough to know how you get into that space with them, but that's something that I know that there's a national campaign that you might want to look at, see what they're trying to do with that.
Absolutely. Now, I know for those that are in rural areas that are, because we do have people still stuck to their phones, it don't matter where you're living at, so if you have those paid digital media things that we can target in, zone in, that's how we were able to zone in on particular age groups and things when we push that messaging out. So we can drill it all the way down to whatever age group in Washington Parish that likes farm equipment, or someone, we can drill it down to the TV shows they watch, all of that stuff, and tailor that messaging for that. But I know that there's still a broadband issue as well. So that's a whole nother thing, like with the buses. And I don't know, I know it's expensive to do mail outs, but sometimes that we have to do that if we can't have boots on the ground in every single small town or area. But that's who's getting it the most, because they're not hearing from these, like we're sitting here on this meeting, and I know that I can head up to New Orleans, or I can head across campus right now and talk to Dr. Brown. That's that trusted face I know, but nobody from my hometown may not know who Dr. Brown is, well, not everybody.
I think one effective thing that we, unfortunately, it comes up, and I'm sure New Orleans, you all are familiar with it. When you have boil water advisories in small communities, we get robocalls.
Right.
Robocalls from elected officials encouraging them to get the vaccine. That might be something you might want to look at, because we use it during elections all the time. But that's another effective media. You talked about phone calls, robocalls with a trusted messenger might be something that might be effective also.
That's a good idea. I'll add that to the list.
Absolutely. Thank you all. Yeah, keep them coming, and email us at any time and let us know.
Anything else anyone wants to share that maybe best practices that's working in their communities? What I've learned from the press conference today that Dr. Cantor gave, that geography for the state it doesn't matter. It's not that there's one hot spot where the Delta variant is and there's more cases, and that it seems to be kind of dispersed throughout the state. And so that lets us know that, the Delta variant is here. What we've also learned is that where the cases are low is where the vaccination rates are high. And so that's, all the more reason, to drive home the vaccination rate and push. Well, you all have given some wonderful suggestions and recommendations. We wanted to, have real conversation about where we are. It is disappointing. The New York Times, I think Dr. Ferdinand shared an email about, was it today, Dr. Ferdinand, with the New York Times talking about?
On the 15th, just yesterday, the spikes that we see in Louisiana being mimicked in other areas with low vaccination rates, including Arkansas. In Southwest Missouri, at least one of the regional hospitals was full, 50 people on ventilators. In Arkansas, there's been an increase in northern Arkansas. There's no reason to think that the state line of Louisiana is so magic that we're not going to see a significant surge Janine did a wonderful job articulating what the communications committee does. And I should mention she has a full-time job and somehow is still able to help manage our committee. I don't know how she does that. But it's important for us to continue to craft messages. We as human beings in general, Dr. Wills can speak to this, human beings tend not to want to believe. You can tell a patient their blood pressure is high and their glucose is 200 and their A1C is 8 and they have heart failure and they still don't change behavior. I don't know, I guess that's helps us get through the day if we close our eyes and wish it away, but I don't think we're going to be able to wish away this virus.
I agree. The first consult I get on every newly diagnosed diabetic is a psych consult because they're in denial. And I don't mean the river in Egypt. People are in denial right off the bat. And when they can't see it and feel it, it becomes a big problem and challenge. But we can't get weary. It's easy to get weary. We just cannot get weary. We just have to keep fighting.
I think Dr. Grimsley wrote in the chat box, primary care physicians still overall trusted messengers for vaccine information, and that is proven to be so true. And in the chat box, Dr. Ferdinand put the link to that New York Times article. So it's there, for your reading. It sadly states that Louisiana is second, I think, ranked second lowest vaccination rate, with only 36% of our population vaccinated, and that we have doubled the cases of COVID since the start of July. So we are nowhere out of this pandemic. We're in it together, and we're going to have to get out of it together some kind of way. We'll move.
Can I leave you with one last little suggestion?
Yes. Yes.
It's like I'm on a suggestion.
No, it's all been good. Very good.
The one good thing that came out of Louisiana is that we have the national champion spelling bee winner, right?
Yeah.
It would be interesting to see if that young lady would be a spokesperson for vaccinations. Yeah, I know she's homeschooled, but how do you spell success? Tying a campaign with someone, that good news of all the bad news we didn't get in Louisiana. I think everyone had a sense of pride when and she's been all over the media. If we could somehow tie a campaign to something that
excellent idea. Janine, see if we can get her and do a video or something, just like, Dr. Wilkes said, how do you spell success? VACCINATE, vaccinate.
Dr. Wilkes, you want to come work over in my office? I would love to have you. I love it.
I have a creative wife.
Give her credit, yes.
Excellent idea. Well, we've given you a lot of little tidbits to work with. And then something on the rural, like Dr. Davis was saying, something that can be tailored, a message for our rural population. And we may reach out to you, Dr. Davis, for some thoughts on that further of some effective messaging for that population.
Dr. Brown, we have a comment in the chat from Dr. Fowler.
Okay, here we are. Dr. Fowler, hello. Can we get a toolbox put together with short messages, videos, and handouts that churches or other small organizations can use? A toolbox that is regularly updated as the message change. I think that's an excellent idea. And we'll certainly, LDH had started working on boilerplate language. I don't know, Dr. Ferdinand, you remember they were going to do some type of one pager for physicians to have so that we were all saying the same message.
Yeah, that easily digestible toolbox needs to be done. We haven't done that. We put a video here and a billboard there and a chat here, but we don't have it in one spot. That's an excellent idea.
Okay. For messages, videos, and handouts. Okay, are there any other suggestions or comments or anything else? Well, this has been a wonderful brainstorming session. I did have one public comment that was emailed from a Yvette Allen. And her public comment was, according to the Louisiana Department of Health, COVID-19 cases among unvaccinated surge makes up 94% of all cases in Louisiana since May. And this is consistent with what Dr. Cantor said earlier. Are there any other public messages, Tracy?
No, ma'am, there are no more comments.
Okay. Well, there are no other further comments or feedback. We will move for adjournment, and I will put together a synopsis of all of these recommendations that have been provided today. Send you all a copy and send it directly to Dr. Courtney Phillips, because that is what she has asked of us. What, give some feedback on what they can do, interventions that they're not currently doing to try to increase our vaccination rates. So this will certainly give them, a starting point with some very concrete suggestions, as well as with our messaging and subcommittee. Dr. Rivera's could not be here today. He's on vacation, but Janine, you did a wonderful job filling in for him. So communicate what we've discussed today back to your subcommittee. All right. Well, I thank you all for joining. This concludes our meeting for today, and we will keep you posted as circumstances begin to change or evolve. Y'all have a wonderful weekend. Thank you so much.
Thank you, Dr.
Bye-bye. Have a good weekend. Bye-bye.
Thank you.